What are the triggers of an allergy? Pollen and dust mites are among the most relevant allergy triggers worldwide. It's important to distinguish between the allergen source, e.g. the grass species, the allergen carrier, it's the pollen grain, and the allergenic proteins it contains, the allergens. These proteins, the allergens, trigger the IgE-mediated allergic reaction. How are allergens classified and how many allergens can exist for specific allergen sources? Allergens are classified as major, intermediate, or minor allergen, depending on how frequently individual allergens cause sensitization in patients. An allergen is classified as being a major allergen if it is recognized by the immune systems of at least 50% of the affected patients and a specific immune response is established. Intermediate allergens are recognized by the immune system of 25 to 50% of patients and minor allergens by less than 25% of allergy sufferers. Repetitive contact of a patient with the allergen source may induce the formation of allergen-specific IgE and trigger a clinical manifestation of allergic symptoms. There are differences in the allergen spectrum of allergen sources. 7 different allergens have been identified in birch pollen so far, and 10 in Timothy grass pollen. The most complex spectrum is shown by the 2 house dust mite species Dermatophagoides perennisinus and Dermatophagoides farine, for each of which more than 30 different allergens have been identified yet. Do all allergy sufferers react to the same allergens from a specific allergen source? In the course of their allergic disease, allergy sufferers are predominantly sensitized to major allergens initially and develop further sensitization to intermediate and minor allergens later in their allergy career. As a consequence, their sensitization profile becomes more and more complex. This is commonly termed as molecular spreading. However, this molecular spreading proceeds quite diversely. Not all allergy sufferers develop an allergy to all and or the same allergens of an allergen source. Usually, a broad range of different individual sensitization profiles can be detected. Learn more in our second film.